I was doing a bit of research yesterday, and in April of this year, you were on a program where you spoke about some objectives and plans for the Ministry of Health.
Yes.
You made the general public aware of the ministry's objectives to improve patient care, customer service,
Yes.
Particularly at the Joseph and France General Hospital. That was in April. We are in the month of October. Where are
Yes.
we right now?
All right. Thank you for that. So the issue of customer service is one that we actually took very seriously, or the one that we take very seriously. Every time the discussions come about with regards to healthcare in its future, and we speak about the need for a new hospital, I can guarantee you that 99% of the times, the first retort that comes back from persons is to say, it doesn't make any sense building a new hospital if you're going to have the same bad staff. And I'm like, what do you mean by bad staff? And, everyone would have some kind of story about an instance in which they received what they perceive as disrespect, or what they perceive as something in the realm of poor communication or bad communication, and the list went on. Even when we look at the general complaints that come from persons, you're able to pick up that the majority of the complaints, it's not really so much the delivery of healthcare in most instances. It's something that someone said, or a type of look, a type of action, or people feeling like the person does not care, and those kinds of stuff. So it was something that, you have to admit the truth. If everyone is saying it, then it can't just be one person's misconception.
Right.
So we embarked upon the decision to invest in some customer service training for the staff. We really were hoping that we could get it done by November, but there was a bit of a delay, and it took place in this year, in 2023. It was facilitated by Mrs. Bradley King, and in total over 200 staff members went through this first pass of the customer service training, and it was successful. They all participated, and they were able to get that level of sensitization and that level of training, whether it was just training with regards to the delivery of service versus training with regards to persons on the supervisory level to be able to relate to staff properly, and even persons that are not directly in contact with patients. You still have to have that training so that you know how to intercommunicate amongst each other. So that was the first pass that we got over 200 staff members to get that training. It's something that's going to be continuous. It's not a one-stop shop. It's something we intend to incorporate and